I'm Dr. Modi. I specialize in infectious diseases. I would strongly urge anyone who has not gotten a COVID vaccine to get one. They're readily available at pharmacies. If you do not know where to get one, you can certainly call Genesis and or go to their webpage, and on the front page it directs you to how to get a vaccine. Each successive wave that we've seen with this virus has and will be different. Last year, a lot of schools shut down, went remote, and so we didn't see as much transmission in that age group. We saw a lot of very big outbreaks in nursing homes before the vaccines were available. And that was very classic for the first wave, especially in the Zanesville area last December and January. Up until the time we had vaccines, we saw spread and severe disease in an older population. With this most recent wave, we haven't seen hardly any nursing home patients because the vast majority of them, as well as a certain amount of the staff in the nursing home, is vaccinated. So we've seen very little of that. What we've seen with this most recent wave is generally a younger population, a rare 20-year-old, and certainly increasing as the ages go up, but more 40s, 50s, and 60s. And if we see people in their 70s or 80s, the vast majority, overwhelming majority of them are unvaccinated. And so that is absolutely what stands out with this most recent wave. Some of the biggest risk factors for getting severe illness in COVID, one is age, which we don't have much control over. Another very big risk factor is obesity, and it may be the second biggest risk factor. Other health factors such as diabetes, hypertension, cardiovascular disease, all those are contributory. But if you look at the patients who get the sickest from COVID, they are overwhelmingly either age-related or have to do with obesity, and obesity is probably the single biggest modifiable risk factor. I look at vaccines very much as umbrellas. Now, most of us, or all of us, have umbrellas. And you shouldn't wait until it rains before you buy an umbrella. If you wait until it rains to buy an umbrella, you are guaranteed to get wet. You're better off buying it when it's not raining. You could walk around with that umbrella every day, and whether you walk around with it or not doesn't affect whether or not it rains. But when it does rain, you pull out that umbrella, it will keep you dry. It won't keep you completely dry. Your feet will get a little wet, and that's okay. But the rest of you will be dry. And that's how vaccines work. The goal behind a vaccine isn't to keep you completely dry. It's great if it does, but if you get a little wet, you got a little wet, okay? But you'll be fine. For those of you who are not vaccinated, I would only ask that your choice be one that you've made of your own accord. We respect your choice, whatever it is, but we are all permitted to change our minds, and if you do so, feel comfortable that if you come in to get a vaccine, you will be appreciated and respected for your choice.